Your doctor doesn't know everything. They just don't. They don't have time. They have a limited amount of time in school to learn about literally every disease state they can cram in there. And then they do residency and fellowships and they focus on specific things. So they might be experts and know a lot of data, a lot of information about certain topics, but they don't know everything. That's why when you go to the doctor and you say, I have this and this and this, and they're like, I don't know. Let's think about it. Or, I've tried these two drugs, but I don't really know what else to try. And then they talk to their fellow, physicians or pharmacists or PAs, and they might all have different opinions. Or they do medical rounds and they kind of bounce things off of each other. Or they do, you know, they'll get together with other experts in their field and bring case studies and say, I have this interesting case. What do you think about it? And that just goes to show you that they just don't know everything, and they can't. They physically can't. There are so many diseases, so many drugs, so many um different ways the bodies work within themselves, let alone like in a population. That being said, when it comes to vaccines, that is probably one of the least researched topics of most physicians. And I'm not saying all, there are expert vaccine um, physicians and pharmacists out there. That's like their bread and butter, right? They're looking at it. But for the most part, I would say 90+% of physicians out there, including pediatricians who do vaccines every single day, have never actually looked at the data because they just go with what the experts say. The experts said this, I'm going to trust them because that's what they told me to do. So I follow the CDC guidelines, I follow the immunization schedule, I do what I'm supposed to do. So as a parent, when you go in there and you start questioning vaccines, I wish they wouldn't do this, but most physicians will make you feel dumb and say, well, I know better. I'm the physician. Don't you trust me? And the answer is actually no, I don't, because 90+% of physicians have not actually done the research themselves. They haven't looked at the data, they haven't looked at the history. And when they do, they get in trouble, basically. Like when physicians start noticing trends, or, my kids who are not vaccinated seem to be healthier than my kids that are vaccinated, or, I did notice this weird thing that happened after so and so got vaccinated. So they'll start asking their colleagues, and their colleagues are like, you're crazy. It's been shown to be safe. Don't even look into it. And these physicians are basically scared into not doing anything. And every once in a while, you have a physician who comes out and says, actually, I'm willing to risk my reputation and my job to look into the truth of this. So these are people like Dr. Suzanne Humphreys or Dr. Andrew Wakefield. And I know these are like, for all of these physicians who are so pro vaccination, pro immunization, especially for kiddos. These are like cringy names, right? Dr. Andrew Wakefield is the physician in England who did the autism study with the MMR vaccine. That's the measles, mumps, and rubella vaccine. And what he did is he looked at a handful of patients, not a lot. I think it was like 15 or under patients. And he looked at video of these kiddos, these babies, before they got their MMR, which is at 12 months. And then he looked at video after, and he noticed that the babies who got the MMR did seem to have more autistic symptoms after the MMR, but looking at their videos from before it, he didn't actually see any of those same symptoms. And, there's parents all around the world who just swear that the MMR or any vaccine caused their child's autism. I actually have a friend who said that her kiddo was totally fine and she did his normal vaccine schedule. And like the day after he got, I don't remember what vaccines, he started showing signs. And she said, I am convinced that's what it was, but I am also convinced that the benefits outweigh the risks. So she just continued vaccinating her child and then vaccinated her second child as well, who also ended up developing autism symptoms. But this Andrew Wakefield, Dr. Wakefield, who did this study, who noticed a trend or a correlation between the MMR and autism, actually never said the MMR caused autism. And it was actually published in the Lancet at the time, but it was pulled almost immediately. And what the study said, you cannot find it, by the way, they pulled it. So it's very, very difficult to find any information on this other than what you're getting in the propaganda online and what they'll basically let you see, right? So Dr. Andrew Wakefield said that I think there might be a correlation, not a causation. Causation means that I can prove that this thing caused that thing. He just said it looks like there might be some correlation between the MMR and autism. And that's what he published. He just said a correlation. We should probably look into this just to make sure we're safe, right? That's all he said. And he got blackballed. He literally got blackballed, license removed. He now lives in the United States, probably like trying to seek, you know, refuge here because he was so blackballed by the medical community for daring to say there might be a correlation between MMR and autism. He didn't say there was. Now, since then, I think he's come out pretty strong. He was actually willing to risk his entire reputation on this because he felt so strongly that there was a correlation, and all he wanted to do was study it more. And the fact that they weren't even willing to consider studying it more from this data that he presented is kind of concerning. Like, as a medical professional, I feel like the truth matters above everything, and we want to make sure that we are treating our kids especially the best way we can. And if you're not willing to look into truth and find, sometimes it's inconvenient truth, right? He was willing to stake his reputation. Another physician who did that was Dr. Suzanne Humphreys, and she was recently on the Joe Rogan podcast. And she wrote a book called Dissolving Illusions, which is just amazing, by the way. Read it because it has so many references. If you're like, this is crazy talk, literally every single page has 2, 5, 7 references on it to reference every single data point she talks about. So Dr. Suzanne Humphreys was a nephrologist in a hospital for a very long time. And within a week span in 2009, she had 3 very healthy young adults, like 40-year-olds, come in with acute kidney failure. And that's incredibly rare to have someone who's just super healthy come in and acute kidney failure. Usually it's from like dehydration, they worked out too hard, they haven't been drinking, they've been out in the sun. None of those. It was not a dehydration working out issue, it was acute kidney failure. And she asked them, what do you think it is? Did you do anything different? And the first guy said, well, I got the swine flu shot because that's when they had the swine flu, 2009. And she was like, oh, it's not related, right? Like every other physician, it's not related. They've done the data, they've done the studies, it's not related. And then case number two came in the same week. And she said, do you have any suspicions? And they said, yeah, I just got my swine flu vaccine. And she was like, that's weird. That's what that guy said. But no, it can't possibly be. That's just a fluke. And then the third guy came in and said, I just got my flu shot last week, the swine flu shot. And she was like, okay, now it's weird. 3 in 1 week in one hospital in healthy people. It's weird, right? So that's what kind of got her ball rolling in her head because she was pro vaccine her whole career. Everyone should get a vaccine, especially kidney patients. They're at risk for infectious diseases, flu, pneumonia. She's checking the box when she's working in the hospital saying, yes, get the flu shot, get the pneumococcal, right? But then she started thinking about it and she's like, why do I have 3 patients in 1 week? That's really weird. So she started asking her colleagues in the hospital. And she literally had one of her um, lead physicians corner her in the hallway one day and was like, you need to stop asking questions. And she's like, what are you talking about? I'm just asking questions. Don't you think it's weird? Maybe there's something wrong with the swine flu batch. Maybe these people got a tainted batch of something and it's causing kidney failure. And he said, you need to stop asking questions. And she's like, okay, well, she started just doing things in the hospital and unchecking the flu shot, right? She was like, okay, I'm not going to give my acute kidney patients the flu shot. They can get it when they go home, right? And then the hospital started questioning her and say, why are you not giving your people flu shots? That's like standard of care. It's literally in the protocols when you go to the hospital, you get these shots. And if you haven't had them before, we give them to you. And she said, well, because they're acutely ill and I don't want to do anything to make them more acutely ill. And they're like, well, of course not. The flu shot doesn't do that. And she's like, but I'm kind of questioning if that's what caused it to begin with. That's what got her going. And she started looking into swine flu, which probably led her to the flu shots in like the 1970s that caused significant harm, and they actually pulled them from the market for a while. I mean, there's people I have as patients who are in their 60s and 70s, and they're like, yeah, I got the flu shot once when I was like 25. It made me so incredibly ill. I will never get one again. And at the time I was like, well, that's because we had different technology. We had um it was just different at that time. Our medicine was different, but our flu shots now are totally fine. They're inactivated influenza, right? They shouldn't cause problems. But now Dr. Suzanne Humphries is like, something's going on with this batch. And then it led to all flu shots. And then she started looking into, just what is the history of shots in general? What is smallpox? Where did it come from? How about polio and pertussis and measles? And she wrote this amazing, amazing book, fully referenced with so much data on all of these vaccines that basically debunk the status quo. And so she is now probably a blackballed name in medicine as well. Dr. Suzanne Humphries, Dr. Andrew Wakefield, how dare they look into this and question any of it? And I just want to put a little blurb in here about smallpox. When they were doing smallpox and it was mandatory because of the, pandemic of smallpox that was, and it was very lethal at the time, they were requiring everyone to get the smallpox vaccine. And it was actually creating more smallpox because it's a live inoculation. So people were getting more smallpox. It was spreading more frequently because they were giving people smallpox as they went. And there was actually a point in England where they removed the mandatory inoculation at the time. It wasn't really an immunization, but they removed the mandatory inoculation of smallpox because they saw such a sweeping spread of smallpox. And yet it continued for another 100 years, 150 years. I mean, they were still giving smallpox up until like the 1960s and 70s, um, even though it was causing so many problems. So that's just a little blurb about smallpox. I really highly encourage you to actually do your research because physicians don't. They don't have time. They're dealing with sick kiddos who have asthma and sinus infections and strep throat and upset tummies, and they have so much to deal with. They don't actually do the data. They just rely on the experts to do it for them. And they've never actually done the research for themselves. And I was one of those. I was one who said, yes, if you have cardiovascular disease, heart disease, you have to get a flu shot. And if you don't, you're crazy because it can increase your risk of death if you don't get the flu shot. You should get the flu shot. And I didn't actually have time or really the drive to look into it. I had other things I was working on. I worked in cardiology, so that means that I was focused on heart drugs, what to do for cardiovascular disease, heart failure, all of the just cardiac information. I didn't even have time or the drive at all to look at immunizations. And it wasn't until recently, 5 years ago, something happened 5 years ago that made me curious about previous vaccinations because of the way the vaccine came out 5 years ago. And I hope you know which one I'm talking about. I became very concerned because it came out so quickly. I mean, they only studied it for 12 weeks before they basically said everyone in the world needs to get this vaccine. And that's what made me go. That was kind of my Suzanne Humphries moment or my Andrew Wakefield moment when I thought, wait, we only have 12 weeks of data for this vaccine and we're just going to literally give it to the entire world. Kids, pregnant, breastfeeding, grandmas, everybody got this vaccine. And I thought, is this how we've done this forever? And that was my wake up call to look into the research myself. And then I started having a lot of conversations with my child's pediatrician. And at first I was kind of pushing back saying, I don't want Tdap when I'm pregnant. I don't want to vaccinate my kids anymore because I did the research and I have decided as a mother and a pharmacist, we're not vaccinating our kids. And I know that sounds insane to most people out there, but I started having a lot of discussions with my pediatrician. Lo and behold, a year or two after I started these conversations with my physician, he started looking into it. And now he doesn't recommend these vaccines. He said, I might recommend polio if you go to India where there's an endemic of polio. But other than that, I don't recommend these vaccines anymore. And it simply took him looking into it because he never did. He didn't have time. He just accepted the status quo, what the experts told him, the CDC said it. That was that. And you know what? I respect my pediatrician that much more because he cared enough to look into it. And this guy has no time to look into anything. I am just shocked that he made the time to look into it, and he has done a complete 180 just like me. So the reason I wanted to make this video is because I wanted to empower you to be your own advocate, because these physicians, pharmacists, nurses, nurse practitioners, PAs, we just don't have time to look into everything. And when they say they know better than you, that's just because they're following the experts who probably have, as we have come to find out in the last 5 years, agendas, right? They have agendas, they have money behind all of it. Let me bring up a perfect example. Dr. Paul Offit is a pediatric immunization expert, and he is on the board of the ACIP committee. I can't remember what that stands for. It's something with American College of Immunization Practice or something like that, ACIP. And he sits on the board and he helps push these vaccines. He's giving these vaccines to children, and he's creating the vaccine schedule. He's the one who was on the board to decide that kids as young as 6 months old need a COVID shot, even though they're not even at risk for death from COVID, and it doesn't decrease transmission. It's just insane. Anyway, he sits on the board. He also developed a rotavirus vaccine, and he owns the patent for it. And then he voted as a board member to add it to the childhood vaccination schedule. To me, that's a conflict of interest, right? If they're going to add it, he should not even be involved in the conversation. He may be a board member, but they say, you know what, conflict of interest, you are not a voting member on this particular product because you get royalties for every vaccine that gets administered. And so he was still a voting member. He owns the patent for rotavirus vaccine. I think it's the Rotarix vaccine. And he voted to put it on the immunization schedule for babies. So it is. Talk about a conflict of interest. So if you're trying to figure out who these experts in vaccines are, well, they're people who are owners of patents or get kickbacks from insurance companies or pharmaceutical companies for the more medications, the more immunizations you give, right? Here's another perfect example. Hepatitis B is a virus that is spread through sexually transmitted disease or IV drug use. Now, do they give it to people who are at high risk for Hep B? Maybe sex workers or maybe more promiscuous, or like college students if they know that they're not going to, they're going to be a little more promiscuous, or people who are at risk for IV drug use. No, they give it to newborns on day 1 or 2 of life. Why? What newborn is at risk for Hep B or IV drug use as long as they know the parents don't have Hep B? I get it. Like, again, that might be a patient who mom and dad have Hep B. You would give the baby the Hep B vaccine. That would be the only time in my brain that a newborn should get a Hep B vaccine, is if they're at risk for Hep B. But 99 out of 100 times, babies are not at risk for STDs or IV drug use, right? So why are we giving them the Hep B vaccine? Because of money. If we only gave it to the small percentage of people who need it because they're at risk, then the pharmaceutical companies and anyone downstream from there don't make any money off of the Hep B vaccine. But if you give it to literally every baby in the hospital, that's millions of babies, millions of doses every single year. So what's the agenda? So again, I'm encouraging you, do your own research. The physicians have not. They do not know the information like you will. And we are in a technology age. It's not like it's hard to find this information anymore. You can just go to PubMed or Google, and you can go into forums, and there's expert witnesses. There's physicians who run these vaccine information websites. You can get the information now. It's not hard. So I am encouraging you to do your own research. Buy the book Dissolving Illusions. I'm not getting any kickback from Dr. Suzanne Humphreys. I mean, if she sees this video, that'd be amazing. But I really appreciated that book because it was so comprehensive. And I hope she does more books like it, because there's a few vaccines she hasn't included in it because, the book was big enough, right? But I'm encouraging you to do your own research, look up the data yourself, and have these uncomfortable discussions with your doctor. And don't feel obligated or pressured to vaccinate you or your family if you are not comfortable with it. And if they are pushing you and saying, we're going to fire you as a patient, then get a new pediatrician, get a new physician, a family doc. I don't care. Find someone who will respect you and your decisions, because you knew you could do your own research, and they haven't even tried to put in that effort. So just know that you can do this, and your doctor does not know everything. If you appreciated this video, please like and subscribe, and maybe share the video with a friend that you know is kind of on the border of vaccines or not vaccines. And I have a few more videos that I'll link to this video that does go into the vaccines a little bit more in detail. Thanks for watching.